And this one here, you can probably eliminate the need to go get x-rays. It's that solid, okay? And it's an adduction examination for your hip. I'm oftentimes trying to figure out and differentially diagnose whether or not somebody that's feeling something down in the hip, like a piriformis syndrome, it would be pain that's on the back side that's into your buttock muscle, okay? Or whether or not it's the hip joint itself where the femur attaches to the acetabulum. It's very common. One of the quick ways that I do this and rule it out is an adduction examination, okay? So I take the leg, and let's just take, for example, this one here will be the right hip. Now, what you're going to notice, here's my 0 point. That means that the leg is parallel with the body. As I take the leg across, in a severe degenerative hip, this is going to start hurting fast. And in fact, it doesn't take a rocket science to figure out that as I drag the leg across the body, you're going to feel a barrier. But the barrier of a dysfunctional hip is I feel it stopping very quickly, and the whole hip starts to move, not just the femur. Okay, so as I bring the leg across, not only is it not moving easily as it should, but the whole hip is following it. And that's because you're taking that femoral head and you're rolling it in, and it's usually a bone-on-bone degenerative change, so you're dealing with hip pain. This would hurt you in various times, both using it, but both sitting for a while. And then across the body I go. And in a normal hip, this leg is going to fall all the way across the body with no pain. And what we're going to do here is we're going to look for pain pattern of a groin. So now, in a normal stretch, if you guys are in the gym doing this stretch, it's a very common stretch here, you're going to feel pain on the outside of the hip, okay? It's a stretch for the hip muscles. But not when you have a degenerative hip. In a degenerative hip, the pattern of pain is a groin pain. The patient or person will often tell me, I feel this in the groin, in the front. And that's the sign that the hip is degenerative. Now, in a severe version of this, the hip literally will not come more than maybe 5 degrees across the plane of the body. In a less severe version of it, I might have to go all the way to 30 or 40 degrees before I get the groin. But the idea is to look at the pattern. Pain guided. The pain is in the groin, that's a degenerative hip pattern. If the pain is on the back side, that's a normal hip stretch pattern.